it's not a guarantee that in this one cycle of the process you will get the pregnancy. It's the success is about 3 out of 10.
Really?
Yes, 2 to 3 out of 10.
What could be causing that failure after all this 6-month preparation?
It's not really 6 months. This whole thing is just like 1 month.
Oh, 1 month.
And it's
because earlier on you said you can first store the sperm. Is it the eggs for like
the sperms,
like
yes.
for 6 months?
Yes, you store.
Okay.
Now for that part of the storage of the sperm is the work of the clinic. The clinic is doing this because most of these clinics which do this process, and even those which have the sperm banks like ours, we keep the sperms because we know somebody will need it. We keep the profile of the person who is giving the sperms and all that without even knowing who is going to use. Yeah, so when somebody shows up, they need to use it, and we confirm that indeed it will be very important for them to use it, and then we get it.
Okay.
Yes, so that's it.
Thank you so much. There's someone really needing you here.
Yes.
He's saying, Doctor, how much does IVF cost? I think he's planning to take. It's called Charles. Yes. He wants the exact cost that he prepares his pocket. Yes.
Yeah. So IVF. Well, the cost varies, but in our unit, the variation is between 15 to about 19 million.
Is it payable in installments?
Well, usually depends on the exact protocol we are using. Most of them you can pay in parts.
Okay.
Yes.
Okay.
There are which involve some genetic diagnosis, which you have to pay most of the money ahead of time.
Okay. Thank you so much, Doctor. So, when is this sperm donation egg needed? When does the medics decide and say, you know what, I think
you need a sperm donation?
Yes, for now you need sperm donation.
Yeah. So for the sperm donation, the commonest, I will talk about the indication in our environment. I have to stretch that, the indication in our environment. Now, in our environment, the commonest indication for use of sperm donor or donated sperms is a severe problem with the sperms. Either sperms are so few and so abnormal that they can't be used, even with advanced assisted fertilization through IVF. You find that you cannot use them. Commonest absence of the sperms, and even if you try to retrieve from the testicles, you fail to get them, and then the only option is to get the donor sperms. The donor sperms.
Okay.
But also the second indication is genetic diseases. That has to be considered because we talk about too many genetic diseases here. There's one disease called cystic fibrosis. Now, this disease, the commonest presentation is repeated chest infections. So you find somebody is having repeated chest infections, and when you do genetic testing in them, they have cystic fibrosis. And in this case, you cannot use their sperms because the same condition will be passed to the baby.
Okay.
Yes. But also the same situation happens in some cases in people who are sicklers. Now, the man, if the man is a sickler, that is, he has both genes for the sickle cell. That means all the sperms he produces will be carrying the sickle cell gene. And if he meets a person who is either a carrier or who is a sickler, most likely they will produce, chance of getting babies who are sicklers are high. But the possibility, if they meet somebody who is not a sickler, who is not a carrier, all the babies will be just carriers. Now, this is information which they have to look at and see and decide. For example, in the cases where they could get carriers, sickle cell carriers as babies, do they want that or they don't want that? Because those are things you cannot manipulate with genetic engineering at the moment. Yep.
It's very interesting, Doctor. Before I go further, there's someone saying, hello, Doctor. I'm asking, saying good evening. Thanks, Dr. Underbart, for the program. I would love exactly IVF means. And secondly, I have a sister of mine who happened to deliver one kid, but it's now 10 years. She has failed to conceive? What could be the problem? Proceed, because I think they want some clarification about what you're trying to explain.
Yeah, they want what is IVF.
Yeah.